As India continues to battle with the SARS-CoV-2 virus, the crown of India, Kashmir, how did it fare in dealing with the COVID-19 pandemic? I have with me one of the most famous COVID warriors from Kashmir, Dr. Naveed Nazir Shah. Namaskar, sir. Dr. Shah is a well-known pulmonologist from Srinagar and somebody with whom Prime Minister Narendra Modi spoke in his Mann Ki Baat. Uh, Dr. Naveed, how has Kashmir fared during this COVID-19 pandemic?
See, at the outset, when the first wave started here, the first case was detected in Kashmir was on March 18th. Even before the COVID pandemic started, the preparations on ground were at a very good level. The labs had already started. Hospitals were designated as COVID care centers, not only in the main city or in the main hospitals, but even at the basic district level, every hospital had a provision of keeping up a COVID patient. And subsequently, since I would say that the waves which progressed in the country, Kashmir was the last one to be affected. So we got ample time regarding knowing about the management of the disease, the preventive measures, and upgradation of the facilities here. Even at the sub-district levels, at the primary health centers, oxygen facilities were upgraded in the form of new oxygen plants, oxygen concentrators, oxygen banks were established. So if we compare with the rest of the country, I think our state fared far better. The deaths were less. And I would like to say here also that the NGOs which were working in Kashmir did a tremendous job. Not only upgrading the facilities, because hospitals were already being upgraded, and you'll be surprised to know, in comparison to other states of the country, I did not see a single patient admitted in any private facility in Kashmir or in Jammu. So government sector was the only sector which catered to the needs of the COVID patients, and we see that the mortality in our part of the country was far less as compared to the rest of the country.
See, there are many things in which Kashmir has led the way, and let me talk about them one by one. One of them was in when there was vaccine hesitancy, there was limited doses available. Kashmir was able to take vaccines to a lot of people, and you introduced literally to India door-to-door vaccination. What gave you the courage to do door-to-door vaccination?
See, to start with, even before the vaccine was rolled out in the valley, we saw that the hesitancy levels were very high, even as compare if we would have compared that with the rest of the country or rest of the world. I conducted a study which showed that the hesitancy was not only in the general public but also in the healthcare workers. But the administration was proactive with the help of the healthcare officials and with the help of the well-known personalities, which had a good rapport with the people. We managed to convince the people, and the myths and the wrong information, the misinformation which was being disseminated by social media at that point of time. Gradually, the people came forth. They knew that that was the only way that we could get rid of the pandemic. People came forth. At the outset, the centers were established at every nook and corner of the valley. Even not only speaking of the main hospitals, the healthcare centers, the vaccine was made available.
No, but the point is establishing in PHCs, but then taking it door to door, up in the mountains for the Bakarwals, for the Gujars. That was a very bold and big step. Even Bombay and Delhi were hesitating to do that. What gave you, your fraternal doctors, and Kashmir the confidence to do door to door?
See, if you see here, Kashmir has a different terrain. It's not the PHCs and the health centers are not available in the peripheries which have limited populations, and the populations literally disseminated over a wide area of range. So even those kind of people don't have access to social media. They had no information about the vaccination and all those things which were coming up at that point of time. So that prompted the healthcare department, which was very proactive. They went to door to door in the remotest of villages, in the mountains, and in fact they had to face a sort of a resistance initially, but ultimately they had the last laugh and they managed to vaccinate a huge number of people. Even the paddy fields, you could have seen people doing farming and simultaneously being vaccinated at that point of time. So it was a great decision at that point of time, and which led the way, and it was appreciated at the national level, the efforts made by the health and medical education department in the state.
One more fact where Kashmir led the way, and if I'm not wrong, this is the only place in India and probably in the world where you have a floating ambulance, one in Dal Lake. Tell me a little bit about that.
Absolutely. I had the pleasure of meeting the person who started that floating vaccines. Actually, he himself was infected with COVID, and because the fear of COVID at that point of time was huge. People treated the COVID patients as outcasts and as untouchables. So he literally, when he became a COVID patient, it was very difficult for him to go to the hospital, because the mode of transport inside the people who are living inside the Dal Lake is the boat. So once he suffered, he took up a challenge and made sort of an ambulance in his houseboat, and I had the privilege of traveling in that. He has upgraded it into a wonderful manner. He has oxygen concentrators in it. He has all the basic healthcare facilities which are needed, and he was about to upgrade it to even fit up a ventilator inside the ambulance, so that if the need arises, the patient is ventilated inside the boat and he is transported to the hospital. That was a wonderful initiative. It was basically initiated by a COVID survivor. Once he saw
We should be grateful to Patlu for having done that.
Absolutely, absolutely. It was. I was really astonished to see the amount of determination and the free of cost service which is providing to all the people residing inside the Dal Lake. And he continues to not only transport the people who are suffering from COVID, but also non-COVID people who have very less accessibility towards the main healthcare system of the state.
What has been your experience in communication regarding COVID-19? Because we are standing doing this interview at the National Urdu Science Congress. What has been your experience?
See, it has been a great experience. It was a novel virus. Nobody knew at the outset what the virus was, what were the symptoms, what were the mode of transmissibility, and every month we used to have a new update regarding the virus. And it was absolutely a Herculean task which was taken up by the healthcare officials and the administration regarding dissemination of true information to the people, especially when social media was ripe with miscommunication, with myths which were associated both with the disease, with the vaccination and all that, and treatment of the disease. And I think we have tried to do our best, and I think we have quite succeeded in a good manner.
You've been a frontline worker treating COVID patients. Now we are in almost the second year of COVID. What is your expectation? When will this end?
See, I don't see it ending in the near future. See, it's a virus. We don't know how it's going to behave. Ultimately, I feel that it might end up being an endemic sort of thing. But the spikes, the waves, may be coming off and on. As of now, we are seeing that the vaccine is quite effective even against the mutants. We see that even people are getting infected post-vaccination, but they are not developing severe disease. The deaths among the vaccinated are almost negligible. So we see, until and unless the virus mutates in such a vicious manner and makes itself highly transmissible and causing severe disease, I see that we are doing quite well, and there will be upgradations in the vaccinations which will give us a prolonged and a very effective protection against the virus. So ultimately, I see it ending up as an endemic for some time, but I hope that the virus does not mutate in such a manner that it will cause a severe disease, or it will be highly infectious in the near future.
Do you see light at the end of the tunnel?
Absolutely, there always has to be. At some point, we will come to such a place where we will be back to normal lives without masks, without all the SOPs. And I hope the people understand the importance of vaccination, because vaccination is the only way which can bring us to normalcy and to a routine life in the future times to come.
So that was Dr. Naveed Nazir Shah, frontline worker handling the COVID 19 pandemic for Kashmir. And Kashmir led the way in several initiatives, be it door to door vaccination, be it a floating ambulance, and in reaching out to the maximum population of Jammu and Kashmir and in Ladakh for getting the vaccine to them. As Dr. Naveed says, vaccination holds the key in controlling the COVID 19 pandemic. In Srinagar, Kashmir, this is Pallav Bagla.